Okay, I'm Haley Price, and we did our presentation on asthma. So, what is asthma? It is a clinical syndrome that affects your lower respiratory tract. It is known as a chronic long-term lung disease, and normally the tubes in your lungs and airways are affected. So, in the picture, if you look to the left, that's what a normal airway looks like. And then to the right, when you have an asthma attack, it's inflamed and swollen, and there's excess mucus, which makes it harder for you to breathe. So there are also different types of asthma. It's supposed to say allergenic, but you can have allergenic asthma, which comes from allergens like dust, mold, pets, or pollen. Non-allergenic asthma comes from air pollution or even medicine and chemicals. You can get occupational asthma from chemicals or dust at work, which I think is less common. And the most common type of asthma is exercise-induced, which is caused by physical exercise, normally in dry air environments, because your airway is dry, which makes you cough. So the symptoms of asthma include episodic or persistent wheezing. Episodic wheezing is usually when you're having an asthma attack. And then dyspnea and cough. There's also airway obstruction, usually because you have a lot of excess mucus, and airway hyperresponsiveness, which just means that basically anything can trigger an asthma attack and make it difficult to breathe. There's airway inflammation, chest tightness, and shortness of breath, which is why you cough and need an inhaler. So people of all ages are susceptible, but it usually starts in childhood, and normally 7.5% of adults are affected. It's also more common in people who are obese. They are more apt to have asthma. And that picture just shows the symptoms. And to diagnose asthma, your doctor will probably do a physical exam, and they'll examine your nose, throat, and airways. They'll probably check for wheezing or difficulty breathing with a stethoscope. Spirometry can be done, which is a lung test that just involves you breathing into a spirometer, which checks your airways and lungs. It records how much air you blow out, which is your FVC number. So if you have a lower FVC, it means your airways are more swollen, indicating that you have asthma or are going to have an asthma attack. You can also do ELISA, which we talked about in lecture, that identifies clusters of the YKL40 gene. So high levels of these clusters indicate that you have asthma. And the picture just shows that, like, with the genotype, like, more clusters indicate like high asthma prevalence. And you can also do PDG2 as a drug target to reduce the symptoms of asthma. So when you're having an asthma attack, it'll be easier for you to breathe, and you'll have less mucus and less inflammation and swelling.
Okay, so I'm Haley Ford. To start with the underlying biochemistry of the allergic response to asthma, the allergen binds to the antigen, the cell, and then forms the complex of the antigen-presenting cell. The interaction with this complex then goes on to form the Th2 cell. From there, plus the role of the B cell, the mast cells can be activated. So the IgE mast cell, the activation is induced by the interleukins 4 and 13. For the eosinophil mast cell, the activation is induced by the interleukins 5. Both of these mast cells produce granules. Let's see the next slide. These granules include like histamine, leukotrienes, prostaglandins, cytokines, and basic proteins. So these granules, when there's an influx of them, that's what causes the asthma symptoms. So to be more specific with the prostaglandins, the PDG2 prostaglandin facilitates interactions between mast cells such as T cells. So it binds to the receptor expressed on the Th2 cells, which leads to the accelerated inflammation. With upregulation of histamines and leukotrienes, you see more of these PDG2 cells being produced, which accelerate symptoms of asthma. So one mutation that's most common is in the YKL40 gene, which was discussed. According to Gomez and others in their article, Characterization of Asthma Groups Associated with YKL40 Gene Levels, clusters of the YKL40 gene were associated with earlier onset and longer duration of asthma. So normally this gene mediates airway inflammation. So the mutations that increase the clustering of these genes, you'll see more damaged airways and more symptoms of asthma. Another mutation is most common in children is the ORMDL3 gene. This gene is responsible for sphingolipid biosynthesis. When mutations occur, the sphingolipid production is reduced, and then the IgE mast cell, which was shown in the model before, the production gets increased, which then increases the granules, which then increases the symptoms of asthma. So the ORMDL3 gene also regulates the activity of serine SPT and also helps eosinophil trafficking and recruitment in asthma. By reducing ceramide synthesis, this protein can be reduced if mutated to decrease severity of symptoms of asthma.